Hi guys, this is John Adamson, the Rehab and Documentation Guru, making a video for you after a 13-and-a-half-hour day. Very long day, and by the time I get home, I'm going to miss all my younger kids because they'll have gone to bed. But that's just the way it rolls sometimes. Today I saw an interesting patient, and this is the nature of my topic today. Saw a patient with Parkinson's disease and progressive supranuclear palsy. And here we have two progressive neurological diseases. And so the first thing you think about when you see a patient like this, which I know a reviewer will be thinking about seeing two progressive diagnoses, is what is the rehab potential of this particular patient? So one of the things you've got to think about when you're working with patients with progressive disease is, can you prove that there's an opportunity that it's reasonable to expect some kind of progress be made with these kind of patients? This guy has had a progressive decline. It's been over many months. He was directly referred to home health without a hospital stay, but he's had a lot of falls. So if you go to my course, you know we talk about ICE, improvement of underlying impairments, compensation for underlying impairments, and environmental adaptation. And so, first of all, we look at improvements. Like, can we improve this guy's balance and strength and coordination and things like that? And looking at him, consistent with his disease processes, he's got some dyskinesia superimposed by the Parkinson's bradykinesia upon the supranuclear palsy's problem with just lack of postural awareness and different muscular tics and lack of coordination. He's got a lot going on. And so the question is, can we really improve this guy? Well, I had to look at his individual case. And this is, again, very important. I've talked about this in the past. The individual patient is what you've got to look at. And this patient has not had any therapy for a whole year. And he's been basically on TV, not doing much of anything, and a wife who's been trying to encourage him to get up and to get moving. So he's got a lot of deconditioning. Now, deconditioning is not something that Medicare pays for services for therapy for. However, superimposed with these pretty tremendous comorbidities, it makes sense that a skilled practitioner is going to need to work with him because he's definitely got a lot of strength deficit. I think it's improvable. So I'm going to work on strength. I'm going to try to work on his balance because he's really been unchallenged for this year. And so I think even within his disease, his progressive disease, we may have a window of opportunity because I think most of his progression and disability has just been laziness and not doing much. And so there's opportunity, I think, there. But what I'll be monitoring closely is objective standards of performance, and doing standardized tests with him is going to be the key. The other thing that I'm looking at is compensation care planning. And with this guy, he has already signs of the dementia associated with Parkinson's, and supranuclear palsy is also characterized by lack of spatial awareness and impulsivity and having labile emotions. And so his compensation capability might not be very good. And so I probably won't be working on teaching him a lot of things, but I can definitely make some environmental changes. And one, of course, is caregiver training. He's got a spouse who's dealing with a little physical issues herself, but she can manage him somewhat. And then he's got a lot of environmental things around his house. One is a bed that's way too tall for him. So we talked about that. We talked about his physical layout for his bathroom, which is not very safe for him to be managed by his wife. And so we talked about, one of his big fall areas is falling out of bed during the night, trying to go to the bathroom. So making his bed safer, giving him a bedside commode, those would be two environmental adaptations that would probably prevent him from falling. So when we look at rehabilitation prognosis, when we talk about rehabilitation, we're usually talking about improvement of impairments. And maybe we don't have a lot of opportunity there, but we certainly do have in the environmental area. I'm going to give it a shot in the improvement category. And my documentation had to really show that I had improvable underlying impairments for a rehab perspective to work to prove to the insurance reviewers that this is a claim worth paying for. So even in the midst of a progressive disease, and often we're talking about neurological, there is opportunity sometimes for improvement. Just be ready to prove it, because the insurance reviewer might look at that claim and go, disease does not really prove there's rehabilitation potential here. Anyway, this has been John Adamson, the Rehab and Documentation Guru. Hoping you like and subscribe to my videos, and please suggest any topics for future discussion. Take care, God bless, and hopefully you're enjoying your family, even though I'm not enjoying mine. Talk to you later.